So I want to share two really interesting concepts. Both of these come out of the Harvard School of Public Health. I find this is probably the best nutrition institute in the world with two very interesting concepts that Mila will help you with. First is decreasing glucose load, and the second is decreasing inflammation. Now, glucose load is the number one risk factor for women in terms of obesity and diabetes, likely for men too, but the studies were done on women in the Far East and in the United States. If I take a carbohydrate, my blood sugar will go up a certain amount. So if you have something that comes into your bloodstream really quickly and rips up, you have a very high blood sugar. And what happens? Your body is suddenly struggling to figure out what to do with it. Can I stick it into fat stores? Your muscle becomes more and more resistant to it. You're making more insulin. We get sick. So to give you an example, an instant mashed potato scores 120. The top of the score is 100, just like an exam in school. 100 is as good as you can get. Well, it outdid itself here with an instant mashed potato. Mila, a 1. The lowest measurable glycemic index of any food in the world. So the problem is that this tremendous load of blood sugar accelerates fat storage. And it is a load. Picture yourself climbing up Diamond Head here with a little day pack. Now picture yourself climbing up Diamond Head with the kitchen sink, your refrigerator, and some of your bedroom furniture on your back. I mean, you're struggling, you're sweating, you can barely do one step after the other, so it is a real load. Now, most dieters here are smart. They go, sure, I know, I'm not going to have that Coca-Cola, or a lot of them. That's a lot of blood sugar. The trouble is it's multiple servings of a moderate glycemic load that increases the risk. And to make that crystal clear, let's add them up. I start out with a Starbucks bagel downtown this morning. 25. Doesn't seem terrible. Then I have a whole wheat pretzel. Whole wheat doesn't seem bad. I'm up to 28. Now brown rice cakes, been advertised as a great dieter's food. The top score you want to have for a day is 100. That's as much as your body can tolerate. Any over that, it can't tolerate it, and you put yourself at risk for diabetes and of obesity. Now we add pancakes, we're up to 109, and whole wheat pancakes. White rice, 139. Mashed potatoes, whole wheat spaghetti, rice and noodles, angel food cake, cornflakes. Doesn't seem that bad, but look at this score. Healthy maximum is 100. I'm now at 298, which is a crushing load on our system. So let's look at a low glucose load. What kind of a diet could we eat that would give us a very low glucose load? You could start out with a sweet potato, and it's considered the finest vegetable that there is. That's a 17. Black beans, 14. Sweet corn, 9. Tortilla, 4. Amaranth, 4. Cashews, 3. Jicama, 2. Guacamole, 2. Peppers, 2. And Mila, 1. Staggering. Now I'm at 58 for the day instead of 298. And it's no wonder that the fat just drops off of people when they're having enough Mila and when they basically take these other foods and drive them out of the diet. So here it is. Here's the Western diet, 298. Here's an Aztec diet featuring Mila at 58. Now look at the glucose load between white flour and Mila. White flour, 66. Mila, 1. No wonder if we have a diet that's packed with white flour that we get so sick. So let's look at what happens if we put in 4 servings of Mila. We've taken out 4 servings of these high or moderate glycemic index foods, and now instead of 298, we're down at 173. That's pretty good. We've done a great job. But it's an interesting point. And if you just have 1 scoop of Mila on top of all these other foods, it's not making much of a difference. If you have multiple scoops of Mila and you're displacing these glycemic index foods, look at what happens to this score and look at how much healthier you become. Now, inflammation. Why is inflammation bad? Well, inflammation leads to obesity and diabetes and heart disease. I'm giving a talk at the end of the month at Harvard Medical School, and that's going to be on inflammation and brain health. It turns out that if you have someone that's overweight and has a high amount of inflammation, they have all the symptoms of depression. They feel just plain terrible. So a great deal of why we feel awful worldwide is because we have inflammation. If I were to take you on a trip into one of your coronary arteries, the arteries that supply your heart. A healthy one would be pink. It'd be pink and fresh and young and look great. An inflamed one would look like a bad case of acne. It would be red. You'd have things that look like pimples that have a little bit of yellow in the middle of it. And when those burst, what happens? You have a heart attack. Now let's take a look at what happens here with foods. Inflammatory foods, obviously high saturated fats. Kimmy was talking about the omega-6 fatty acids. Corn oil, safflower oil, peanut oil. All of those oils are omega-6s. The more of those, the more inflamed we are. Not enough omega-3s. And I would emphasize that Mila has the greatest amount of omega-3 fatty acids of any food on the planet. Not enough olive oil, and of course the high glucose load that we've seen. Now let's add some foods up and look at inflammation. I have a pancake. Now, anything below 0 is inflamed. And we're going to see how far below 0 we can drive. Pancake, minus 51. Cornflakes, now we're down to minus 123. We add some white bread, minus 212. Add some spaghetti, white rice, a tortilla, and white flour, minus 1328. Staggering in terms of the amount of information that we have. So much so, there's not even enough room on the slide for it. Minus 1328. Wildly inflamed. No wonder we're overweight, have diabetes, have coronary artery disease, are depressed, and feel just plain awful. Now, let's look at anti-inflammatory foods. Some pinto beans, taro, cilantro, add some amaranth. I'm only at 20, and I'm going the right direction. Positive direction means that I'm getting rid of the inflammation. It's anti-inflammatory. I'm moving away from that minus 1328. Cashews, beets, and look at the score for Mila. 77. Now, let's contrast the two. Here's our Western diet at minus 1328. There's our Aztec diet at plus 176. If you remember nothing else from today, simply remember this slide because it shows you the staggering difference between the real poison of the Western diet and what I would call the Aztec diet. Now, contrast Mila to white flour. You get up in the morning, you have 2 scoops of this instead of pancakes, or 2 scoops of this instead of a bagel. Look at the difference. Here's white flour at minus 421. There's Mila at 77. So here we have the highly inflamed diet. Let's fix it. Let's add 1 scoop of Mila, a 2nd scoop of Mila, a 3rd scoop of Mila, and a 4th one brings us to plus 96. Look how we fixed our inflammation. So that gives you a sense of just 2 things. Glucose load and inflammation that I think explains a huge amount of why we're so sick, why we have diabetes and obesity and heart disease and depression, and why Mila really is one of the best. Well, I like to think of foods as medicine. I really do. That's the way I live my life. I think of foods as medicines that you can take lots of different medications for type 2 diabetes, lots of medications for obesity, but as you get fatter and fatter and more, and you have more and more diabetes and it become more and more serious, the medications become blanks. So the best possible way to treat this is with traditional foods, and the best of all traditional foods, as you've seen by the numbers here, is, of course, Mila. Thank you so much.
Dr. Bob.